Hi, Megan here from Wisteria Dental Care with your Tooth Talk Tuesday. Today we're talking all things baby teeth. I often hear questions from my patients about how to best care for their baby's teeth, when do the teeth come in, when should a child start seeing a dentist for the first visit. So there are 20 baby teeth in total, and babies are born with all of these teeth already in their jaw bones. They typically start to erupt around the age of 6 months, and usually it's one of these two right here on the lower front teeth that will come in first. Not always, and if it doesn't happen in that order, it's not a big deal. After that, the teeth will continue to come in, and typically the child has all of their teeth by the age of 3. I will link a chart to show you just the normal eruption pattern for children. But like I said, no worries if teeth come in out of order. As long as they're all in at some point, we don't typically worry. Okay, so once your child starts teething, you're going to see some symptoms. Typically, the child will have some sore, tender spots on their gums. They may be acting like they want to chew on things more frequently. They're typically drooling, maybe a little fussy. These are all really normal things. So what you can do to help your child when they are teething is you can rub the tender spot with your finger. This works a little better if it's their first tooth. Once they get some teeth in there, you don't always want to be sticking your clean finger in their mouth. Even they can bite. You can use a cold washcloth. I would always take a little washcloth, tie it in a knot, wet it, and just toss it in the freezer for a few minutes for my kids. They really like to chew on that. It felt good. Also using, teethers are great. You always want to look for one that is definitely going to be safe for babies. So avoid things with like beads, plastic, anything that can get broken off in their mouth. So using something like a solid rubber teether is probably the best way to go. Definitely want to avoid things like numbing gels like Orajel, teething tablets. These things have been found to be toxic for children. So if it's okay with your pediatrician, I would go with some over-the-counter Tylenol, but just make sure you clear it with the pediatrician first to make sure that that's safe for them. Once the teeth have erupted, you're going to want to make sure that you are providing proper care so that we can start preventing cavities for the child. And honestly, even before the teeth erupt, we need to be taking care of their mouths. So after feedings, taking a wet gauze or a wet washcloth, wrapping it around your finger, rubbing it all over the gums, the cheeks, the roof of the mouth, over the tongue. This is going to help prevent, fungal infections for the baby, but also lets them get used to you being in their mouth and caring for their health. Okay. Once those teeth erupt, you're definitely going to want to switch to a soft baby toothbrush, adding a fluoride toothpaste. Traditionally or historically, we have steered patients away from using fluoride toothpaste before the age of 3. It used to be thought because the child is not able to spit that it could be, cause a harm to them. But the truth is we're going to use a tiny, tiny amount. We're using a smear of fluoride toothpaste, to the smear meaning like you almost can't see it on the toothbrush. And then that way you're able to go in and brush the teeth, provide the preventative benefits of the fluoride for the baby, but you don't have to worry about them swallowing it. It will not upset their stomach or anything like that. It is a very tiny amount. Other things that you can do, there are xylitol tooth gels on the market. There's one by a company called Spry that I used for both of my kids. After meals, I would give them a baby toothbrush to chew on with a little bit of that xylitol gel on there, and they would go to town. It tastes good for them, 1, and 2, the xylitol has been shown to help kill the bacteria that causes cavities. So if you're using both the fluoride with their normal twice-a-day brushing, plus you're giving them a couple exposures of xylitol a day, that definitely is going to significantly reduce their risk. There is a huge epidemic of cavities in children and in baby teeth. So it is something that the dental community is really trying to be proactive about, and to get patients to be using more of these preventative procedures early on. Okay. You definitely want to make sure that you're starting to floss your baby's teeth when they have teeth that are touching. Okay. Avoiding really sugary foods and drinks. Definitely, no juices, no candies, no cookies, things like that really need to be limited. There is no nutritional value to juice. Really, it just increases their risk for cavities significantly. So always making sure that, baby is getting milk and water only is best practices. Okay. Now the baby should be seeing a dentist when that first tooth erupts. So whether it's at 3 months or 6 months, we definitely want to see the child, because that allows us to do the initial examination. We can apply a fluoride varnish to the teeth, and then we can help, educate the parents, give you guys tips, to help keep your baby's teeth healthy in the long term. The dental visit really should, at the very latest, be by the age of 1. That is the current recommendation by the American Dental Association and the American Academy of Pediatric Dentistry. So, hope this was helpful for you guys. Hope you learned a lot. I will post a couple of links for you just for some products that I really like for my kids, things that have worked well for my patients, and we hope to see you soon here in the office. Have a great day.